Hey Ford, what's the easiest thing I can do right now to avoid a heart attack?
That's a great question. First of all, test. Don't guess. Do you really have plaque? If you do, is it soft plaque? So that involves some testing. Do you have cardiovascular inflammation? That also involves some tests. And do you have the number one driver, the number one root cause of cardiovascular inflammation, and then heart attacks, strokes, blindness, kidney disease, erectile dysfunction? In other words, do you have metabolic disease, prediabetes or diabetes? All of that involves digging, finding it out. Now, let's assume that you've done all of that and you do have some risk. Most of us have risk with. It's from metabolic disease. First thing, what do? Well, you want to make sure that your carbs, your blood sugar doesn't stay over 140 very long. How do you do that? You don't eat glycemic carbs. Carbs like apples and oranges and mostly pastas and grain products, rice, for example, or potatoes. You don't eat those things so your blood sugar doesn't go up. The next thing that you do is monitor how much fat you have. Muscle is your best safety valve against metabolic disease. And body fat, especially visceral fat, is your worst offender driving that metabolic disease. So you want to minimize body fat, maximize healthy muscle. One of the best ways to get started with that is types of fasting, like intermittent fasting, cutting down on some of the time that you're eating. Going from a 16 or 17 hour a day eating window to an 8 hour or 6 hour or even 4 hour a day eating window. Even going to a little bit of prolonged fasting. Prolonged fasting, like 24 hours or more. And by the way, if I found out that I had rip-roaring cardiovascular inflammation, that's one of the first things I would do. I would go ahead, learn how to, and get ready to start doing some prolonged fasting. The final thing that I would focus on that I didn't mention was doing some regular testing in terms of my blood sugar, like a CGM. And again, it comes under that category of test, don't guess. So we talked about exercise, getting that muscle where it needs to be. We didn't talk about details on it. High-intensity interval work is some of the best work. If you're not ready for high-intensity interval work, then try REHIT, reduced exertion HIT. Resistance training. So as you see, there's a whole lot of things that can come out of this. But the very first thing, test, don't guess.